Hey guys, Dr. Brotsky here. It's week 25 of your pregnancy. If you haven't checked out the other videos so far, take a look at those. Right now at 25 weeks, the average size baby is about 2 pounds, so that's pretty exciting. You can expect regular fetal movement, and your baby can even have sleep cycles at this point. So you may have more regularity, and you may be able to predict when your baby's going to be awake at certain points of the day. That's always fun to get to know that little person a little bit better. Another thing you might start to have is some more low back pain or soreness. And you also may notice some soreness like in your inner thighs at the top where your groin is and slightly below. That's really, really common as the baby's growing and puts pressure on those ligaments. So let your doctor know if you have any discomfort or any concerns about that. From a doctor's perspective around this point in pregnancy, like I've mentioned before, you're at some point going to get your glucose test in the next few weeks. So just be on the lookout for that. God forbid it was high, which there's different cutoffs for high, but you would need a 3-hour glucose test. A 3-hour test is definitely not fun to do, but necessary so that we can make sure we take the best care of you and your baby. God forbid you would have gestational diabetes. So make sure that you listen to your doctor and just follow all the instructions. The glucose test is really easy to do. There are some alternative regimens. Sometimes I'll have a patient who says, gosh, Dr. Brotsky, I can't keep that amount of sugar down. It just makes me feel really sick. I always tell people, take a nausea medicine before, if that's you. And you know, there are some alternative things like jelly bean tests and some other things like that that can be used as an alternative, but they're really not recommended. The results really are not as reliable, and that's what you need. You need a reliable result for your pregnancy to get the most information. You also may want to ask your doctor or go over in the office what their call schedule is or what their call agreement is if something were to happen and you were to come in the middle of the night, for example. That's good information for you to have to know where to go and what to expect as far as what your doctor's hours are. Things that you should look out for right now are watch your weight gain, like we mentioned before. Average size BMI, you should gain 25 to 35 pounds during a pregnancy total. So just keep an eye on that and check in with your doctor. Ask him how you're doing on it. The other thing to look at is just making sure you're eating a balanced diet, getting plenty of protein and nutrition. And you want to stay active, like I've mentioned before. Take walks at least 3 times a week. Make sure you're wearing sunscreen outside. All those things are really important. Drink lots of water. Take your vitamins. That's it for week 25. Again, thank you for watching my video. Check out the other videos on the same channel, and you can always find me at drbrotsky.com.